I'm going to get started on this part of what we do, which is fibromyalgia, because it's so fascinating for Dr. Kelberman and I to do this kind of work. Because as you're going to see, fibromyalgia, chronic fatigue, and chronic pain are a huge area. And I say are, meaning they're separate, but they're really similar. And it's very confusing for those of you that have experienced fibromyalgia, who have patients who say they have it, or patients who come to us and say they have fibromyalgia. It's like, what do we do with them? Because what does it mean? And why did a doctor diagnose them as having fibromyalgia? So we can't find anything wrong with you, so we're going to treat you for symptom deficit disorder. Some doctors, called rheumatologists, think that everybody has fibromyalgia if they have pain. Other doctors don't believe that there is such a thing as fibromyalgia. And in my training at UCLA, I was at Cedars-Sinai Hospital one day, and my professor gave a talk on fibromyalgia because I asked him to do that. And his words were, and this disgusted me, I'm going to tell you that in advance, his words were, fibromyalgia is a syndrome for candy-ass women. Okay, because 75% of people with fibromyalgia are females, 25% men. That disgusted me to hear that. And when he said that, I just kind of shut down. He had nothing really more to tell us, his young doctors. So this is a guy who's a traditional doc. He doesn't really know what he's talking about because he's never studied the area on how to really heal anyone. He looks in his book and he goes, well, we don't know what it is, so I don't know what to do with you. Maybe we'll give you some antidepressants or something like that. So a lot of people that have these type of syndromes get very confused because they don't know what it is, their doctors don't know what it is, and they don't know what to do about it. Now, the American College of Rheumatology has a definition for fibromyalgia, which is not real. And what you'll get out of my lecture is that there's the traditional fibromyalgia, which I don't believe is real, because it's standardized. It's the Bible for the traditional doctors. Okay? But it doesn't deal with how do you treat someone that has a lot of different syndromes or a lot of different issues, and we do know how to treat people. We get most of our people with, quote, fibromyalgia better. But it's not with this paradigm, and I'll show you what it is. Widespread pain for greater than 3 months. Big deal. Pain in all sides of the body, pain in the right side of the body, pain above the waist, pain below the waist. Is that fibromyalgia that we see? No, it's not that definite. Axial skeletal pain, cervical spine or anterior chest or thoracic spine or low back pain. This is the one that really gets me the best. You have to have, in order to have fibromyalgia, you have to have pain. And I'll show you these diagram. 11 of 18 tender points on digital, meaning finger palpation, of 4 kilograms per centimeter and a half squared. Okay. Does that fit anyone? Not human beings, really. Now, we have people coming all the time that we consider to have part of the syndrome, but they may not have any of those tender points. But they're sleep deprived, right? That's part of this thing. We'll go on to what that's all about. So tender points can vary from day to day. The degree of tender points tend to predict functional limitation, but the correlation is very far from perfect. What that means is it doesn't really mean anything. Individuals less than 11 of 18 may still have severe functional limitations or chronic pain syndrome, but the rheumatologist will not call it fibromyalgia. It doesn't fit the category. The cutoff between fibromyalgia and chronic pain syndrome is somewhat arbitrary. It's extremely arbitrary. Now, I saw a lot of people that raised their hands that had pain, almost everyone in this room. Even you didn't raise your hand, but you said your foot hurts. Most of you do not have fibromyalgia. So many issues. Pain, chronic fatigue syndrome may be part of it. People that have the pain in their body often are just exhausted. Non-restorative sleep, what does that mean? People can sleep 10 hours, they wake up, and they say they feel like they're hit by a freight train. They feel like they didn't sleep. And actually people with fibromyalgia say, I didn't sleep all night. Even if they had a sleep study that shows they slept all night. Very often people fall asleep easy but wake up many times. Or they can't fall asleep. It goes in a different pattern for different people. Cognitive issues, brain fog. Anyone here have brain fog? Okay. And that's part of a lot of different issues. One can just be hormone decline can cause that. Because the number one receptors up here, estrogen and testosterone. And males go through andropause while females go through menopause. It's the same thing in life. As we get older, we're genetically X'd out of the food chain, and it's not our job to procreate anymore. But very often people will be with you talking to you and they'll forget what they're talking about. Or when they're moving around doing their work, they may say, I can't really keep a good focus anymore. Irritable bladder, chronic headaches, poor stamina. People try to exercise, they don't have the energy anymore. Vulvodynia, anyone know what that is? You guys heard Oprah talk about the vajayjay? No one in this room knows what that is, huh? Yeah. It's the outer area of the vagina. And some women will have an issue where it's just extremely painful, but no doctor can find out why it is. And it's associated with fibromyalgia. Orthostatic hypotension, everyone ever stand up and they feel dizzy? Yeah, it's part of the syndrome also. Postural orthostatic tachycardia. Similar type thing, the carotid baroreceptors, which normally are going to pump up the blood pressure when we stand up, do not do that. And so the heart has to beat very fast in order to get the oxygen around to the brain. Part of this also. Anxiety, you bet. Depression, you bet. Delayed post-exertional flare-up, what is that? Many cases of fibromyalgia and chronic fatigue syndrome, patients may do well in intense activity, but pay the price later or the next day or the next week. Anyone have that ever happen where they go out, maybe they're walking very far at a mall or going on a hike, they feel great. They wake up the next day and they just feel like they're slammed. Some people it happens 2 days later where they get a flu just from exercising. This is, by the way, Christiana Paul, I want to introduce you, who is probably one of the finest nutritionists in the world. She works for a supplement company called Designs for Health, which a lot of you know about. And she is one of their main researchers. So anytime we have a question about any kind of biochemistry, supplements, or nutrition, I can call her up at midnight and she's working. Is that right? I've done it, haven't I? Or I'll send out an email and it'll come in at 2 in the morning. Yeah, we both are late nighters in terms of the work we do. So a physical examination, what do you do for fibromyalgia? You're looking for tender points? I don't really care. But the traditional docs, the rheumatologists, will look for those because they want to have a note in their chart that says the person has all these different things we're talking about, they have these number of tender points, 11 of 18, therefore they have fibromyalgia. I could care less. I'm interested in getting a person better. I don't care what they have. I've never diagnosed one person in the many years I've practiced medicine with fibromyalgia. Why do you think I don't diagnose people with fibromyalgia? It's a branding iron. Then they walk around going, I have fibromyalgia, I'm never going to heal up. Is it really fibromyalgia? I don't think there is such a thing. We'll get into that. So findings on examination, often none. You can check a person out, you don't find anything wrong with them. They do not predict the severity of symptoms. Whoops, another slip by, but I'll let it go. So oftentimes there's no lab findings. When you take blood, nothing is abnormal at all. And you're expecting to find high sedimentation rate, which means inflammation of the body, things of that nature, maybe a high C-reactive protein. Normal complete blood count, normal creatinine, that's a liver, kidney function. Normal electrolytes like sodium, potassium. Normal liver function test. Normal ESR, which is how fast the blood cells, it's just a technique, how fast they settle. Normal CPK, that's a muscle enzyme. You'd expect with people that have a lot of pain, they have inflammation, but it doesn't necessarily show up with, quote, fibromyalgia patients. Normal TSH, thyroid stimulating hormone. I wrote that in. Who cares? How many of you have had your thyroid checked? Doctor check your TSH? It's usually what doctors check. Does it mean anything? No. Because that's not the thing that kicks up your metabolism, makes you feel good. I would say that probably 90% of the people in this room are hypothyroid to some extent. Maybe 100% of us. But it's undiagnosed because most of us have what we call subclinical hypothyroidism, which means you look at the labs, mainly TSH, which the traditional docs do, and they go, your TSH is fine, don't worry about it. But the active form of thyroid to get your metabolism kicked in, so you're not freezing cold all the time, so you're not constipated, so your hair is not falling, all these kind of issues related to hypothyroidism relate to free T3. That's the active form, but it's never checked. I rarely ever see it checked.